listen to the media briefing today in English or French. To do this, please go to the bottom right-hand corner of your screen, click on the globe icon, and select your most preferred language. Yasmina, in French, please.
Oui, bonjour à tous et merci de nous avoir rejoints pour cette conférence de presse de l'OMS. Et si vous souhaitez écouter la conférence en français, merci de cliquer sur l'icône en forme de globe située tout en bas de l'écran à droite. Merci.
Merci, Yasmina. Joining us from Brazzaville, Congo is Dr. Matshidiso Moeti, the WHO Regional Director for Africa. And Dr. Moeti will introduce our other panelists.
Thank you, Mary. Greetings to our journalist colleagues. Bonjour à tout le monde et bienvenue. Thanks for joining us for this press conference, and also welcome to everyone who's watching online. So today we're going to look at access to vaccines and the circulation of variants on the African continent. I'm very pleased to be joined for this conversation by Ms. Aurelia Nguyen, the Managing Director at the Office of the COVAX Facility. A warm welcome to you, Ms. Nguyen, and by Professor Tullio de Oliveira, the Director of the Research and Innovation Sequencing Platform at the University of KwaZulu-Natal in South Africa. Welcome again, Prof. A warm welcome to you both. Thank you so much for joining us today. Africa has just marked its worst pandemic week ever, surpassing the second wave peak. During the week, which ended on the 4th of July, there were more than 251,000 cases, a 20% increase over the previous week, and a 12% jump over the January peak. A few weeks ago, we projected this milestone would be reached shortly, and it really brings me no joy to have been right. In total, on the continent, there have now been almost 5.7 million COVID-19 cases, and 146,000 people, sadly, have lost their lives. New cases have increased for the 7th week running. For Africa, the worst is yet to come as the fast-moving third wave continues to gain speed and new ground in countries. To end this is still going to be several weeks away. Cases are doubling now every 18 days compared to 21 days a week ago. 16 African countries are now in resurgence, with Malawi and Senegal added this week, and the Delta variant has been detected in 10 of these countries. The continent still struggles to gather the information needed. The identification of which variants are circulating in a community has an immediate value to national response teams to inform adjustments to public health and social measures, including sometimes decisions on vaccines. Some countries have yet to build sequencing capacities to detect variants, and even countries that are doing sequencing are hitting against barriers of limited capacity and resources. We can do more to fill these critical information gaps with the resources at hand. In the context of increasing cases, deaths, and limited resources, we're encouraging African countries to integrate PCR screening assays that can detect variants as a complementary approach to sequencing. Assays are easy to use, fast, and can be done using PCR equipment that's already available in all African countries. And while assays will provide information on which variants are in countries, sequencing is still very important to understand further mutations. Turning then to the COVID-19 vaccine rollout, we're seeing some signs of hope. After coming to a virtual halt in early June, vaccine shipments are gathering momentum. In the last 2 weeks, more than 1.6 million doses have been delivered to Africa through the COVAX facility. Thanks to France, another 300,000 doses of the AstraZeneca vaccines are expected today in Kenya and Somalia, and donations from Sweden and Norway to additional countries are currently being finalized. COVAX has been working tirelessly to clinch dose sharing pledges and procurement deals with manufacturers to ensure Africans get their vaccines. We expect more than 20 million doses of Pfizer and Johnson & Johnson vaccines to arrive from the United States soon through COVAX in coordination with the African Union. Other significant donations are expected in the coming days from more partners, and Ms. Nguyen will tell us all about this. There is still a long way to go. So far, 50 million doses have been administered in Africa, accounting for just 1.6% of doses globally. 16 million, or less than 2% of Africans, are now fully vaccinated. This means that hundreds of millions of people are still vulnerable to infection and also to severe illness, I might add. With much larger deliveries expected to be arriving in July and August, as a region, we must use this time to prepare to rapidly expand the rollout. Governments and partners can do this by planning to expand vaccination sites, improving cold chain capacities beyond capital cities, sensitizing communities to boost vaccine confidence and demand, and ensuring that operational funding is ready to go when it is needed. As WHO, we're supporting countries to document the lessons learned, to identify programmatic barriers, and to scale up good practices to make the most of every dose of vaccine. So I look forward very much to our conversation today, and thank you once again for having joined us.
Thank you, Dr. Moeti. Ms. Aurelia, could you tell us about the ongoing efforts by COVAX and partners to secure more vaccines for Africans?
Thank you very much, moderator, and thank you, Dr. Moeti. Bonjour à tous et à toutes. It's a real pleasure to be here today. So as of today, nearly 50% of all the vaccines that have been administered in high-income countries, compared to 14% in low and lower middle-income countries. COVAX was set up to avoid the mistakes of past pandemics and make sure every country has access to vaccines, not just a select few. And so the model that we have built for equitable distribution has now delivered 25 million doses, as you've heard, to 44 countries across the continent. So that's about a quarter of the entire global deliveries that COVAX has made. So we're not happy with this progress. It is some progress, but not enough. And we're not happy with the circumstances that led last year to most of the early global supply vaccines being snapped up by wealthy countries before COVAX had received the money to procure its own vaccine supplies. So as we've seen here on the continent and elsewhere, the longer this virus circulates, the more likely it is that the highly contagious variants we're seeing will continue and others will emerge. And the need to get more vaccines to Africa and other underserved regions has never been more urgent. So what has COVAX been doing to address this need? For one thing, we have been aggressively pursuing our strategy of portfolio diversification. The COVAX portfolio now consists of 9 vaccines and vaccine candidates. And we have legally binding contracts in place for 2.8 billion doses. And we also have commitments for further 1.3 billion doses. For Africa, according to our latest supply forecast, we will have supplied 520 million doses by the end of this year, rising to nearly 850 million by the end of the first quarter of 2022. These are all funded following our successful fundraising summit that we had in early June. And indeed, now we have the resources in place to be able to protect up to 30% of the population in every African country eligible for doses through what we call our COVAX Advanced Market Commitment, or AMC. As I mentioned, the majority of these doses will be delivered from September onwards. In the interim, countries with excess doses are sharing vaccines with COVAX. As you've heard this week, dose donations from France reached Mozambique and Zambia. Kenya and Somalia are set to receive vaccines today. We are also working very closely with our partners in the US government and in coordination with the African Union to facilitate dose sharing from the US, as well as other donations from other countries. So I want to leave as much time as possible for questions. So I'll end my remarks here and hand back to you, moderator. Thank you.
Thank you, Ms. Aurelia. Now I turn to you, Professor Tullio. Can you please tell us about how the Delta variant is driving the current surge in cases?
Yes, of course. Yeah. Good morning, Dr. Moeti, Dr. Mary, and all colleagues from the WHO and COVAX. it is always a pleasure to be with you, yeah, and also work together with many African countries and ministers of health, what we are doing at the moment, to try to understand how these variants are causing almost havoc in Africa. At the moment, it's really worrying, the situation. So I have prepared around 20 minutes presentation, if that's okay. We will start just giving information, very new information that we found in South Africa in the last week and a half, which was presented through our president, and that increased the level of restrictions in the country. But then also touch a little bit on how widespread is the Delta variant in Africa. And then I will highlight some basic information on transmissibility, clinical symptoms, and the effects of vaccines, yeah. So I will just start here, just give me 1 second, yeah. I hope you can see now my full screen. So that's basic update on Delta and other variants in South Africa and Africa, which the most recent data come from today, the 8th of July. And I have prepared this presentation with some colleagues of mine, Ruria Tegal and Richard Lassos. But in reality, we are talking not only from our group. Yes.
Sorry to interrupt you. Can we have the update in about 3 minutes so we can allow time for journalists to ask questions?
No problem. I can easily do in 5 minutes or 10 minutes. Yeah. And so just to highlight, yeah, just to start, I would just to start with 30 seconds, just to us to reflect a little bit what's happening in the world today. Yeah. So that's a piece from this morning from one of the most respected journals in the world, The Guardian, yeah, really highlighting some excellent celebration that were happening in the country as they go to the final of the Euro Cup. A few days ago, it also came another piece in another very respectful newspaper in the world, the Washington Post, which that one was co-authored both by John Nkengasong, Dr. Tedros, yeah, our president were interviewed, and also myself. That just to show the disparity, what is happening in the world now, yeah. Whereas some countries are really celebrating getting out of the pandemic, in the middle of Africa, we are really in an extreme third wave. Yeah. What is causing this third wave? Yeah, what's caused this third wave? It is just to explain you here in a minute. Yeah, it will be here in the x-axis is the dates of sampling, in the y-axis is proportion of genome. In South Africa, we set up an effective genomic surveillance that's starting around February, end of February last year. When I have gray, I have many lineages circulating. We have the appearance of the first lineage variant of concern in Africa, that was the Beta, which caused a devastated second wave in South Africa and Southern Africa in general, also entered East Africa. And then what we see here is the introductions of other variants of concern. First the Alpha, but which do not go in prevalence, and then the Delta. This very, very, very fast growth of prevalence of Delta, now dominating around 80% of the recent genomes in South Africa. Extremely, extremely force of infection, yeah. If you look more specific at the granular level in South Africa at the provincials, what we have seen this continuous replacement of the Beta variant with the green one, the Delta variant. Seen initially by our group in KwaZulu-Natal, but in Gauteng, that's the main economic hub of Johannesburg and Pretoria, Western Cape in Cape Town, and now being detected across all the other provinces. Yeah, that would be worrying per se if you don't realize that not only what we detect early in KwaZulu-Natal, again, that's the dates, very recent genomic data, that as you increase the prevalence of the Delta, you also have this very fast growth of cases, yeah. So it's really, really associated, fast increase of prevalence of genome sequence of Delta, and we enter this exponential growth of infections in KwaZulu-Natal. We detect that in the beginning of the third wave. We confirmed that on an explosive wave in Gauteng, again, very fast increase of the Delta, with the numbers really going much higher than have ever gone. In Gauteng, we have around 12,000 infectious a day in a 7 days average, but in reality it's much bigger. It's a positivity rate of 30% with hospitals completely saturated. Yeah. We see that replicated in 4 other provinces in South Africa with recent data, Western Cape, home of Cape Town. Yeah, as you see, the green start to emerge, that's on the left, and the cases shoot up. In the Eastern Cape, in Limpopo, a very impoverished province of our country, in Mpumalanga. So we have seen that over and over, increasing of Delta, increasing with much higher number of cases. Yeah. I'm not going to get into much detail. I will give you in 2 minutes. I will finish.
Yes,
yeah.
Thank you.
We know the mutations of that variant. We do worry a lot about a number of mutations of that make much more transmissible. But what we really worry at the moment, and just to bring you very recent data, is that it has to begin to dominate not only South Africa, but all the African infections. Again, this is when you pull all the data of Africa together, around 75% of the recent genomes of Africa is Delta, and has entered all regions of the continent. Yeah, we are talking about Southern Africa, East Africa, West Africa, Central Africa. As we increase genomic surveillance, more important is really increasing the response, given that this Delta variant is much more transmissible. It causes potential risk of reinfection with the Beta. But the good news, if there is any good news in explosive third wave with no vaccination, is that no evidence of vaccine escape against this variant. So more than ever, it's time to increase vaccination. Thank you, Dr. Moetse. Thank you, Dr. Mary, and back to you.
Thank you very much, Prof, for that swift summary. We will definitely share your slides with all the journalists for their information. Now it's time now that we have heard from all our panelists to you journalists to ask your questions. And to do this, please use the Zoom platform, the Q&A platform on the Zoom. Give us your name, the name of the media organization you represent. And if you want to go live, please raise your hand. So we are going to start with a live question from Kelly Jane. Kelly, are you there? Okay, if she's not there, let me read the questions first, and then I will still come back to you. So South Africa is in the grip of the third wave with only very proportion of the population vaccinated with their first dose of the Pfizer vaccine. A similar challenge is being faced in many African countries that have limited access to other double dose vaccines. Does it make sense to provide second doses, or should government consider administering just one dose to as many people as possible so they at least have some protection? I'll give this question to Dr. Moeti. And Dr. Richard Mihigo, you could complement.
Okay, thank you for that question. A very good question in the current context, which we hope to soon get out of with vaccines becoming more available. So WHO generally advises countries to vaccinate as many people as possible with a first dose, particularly those in the highest priority groups who are most vulnerable to developing severe illness and dying of COVID-19. And that is what we have been promoting throughout. However, we are now thinking that in countries like South Africa, where the Delta variant is predominant, WHO currently advises giving a second dose to the highest priority, most vulnerable people, and making sure that they get this at the correct time in terms of getting the highest level of efficacy against the variant. This is to make sure that you then, for this fast spreading virus, don't get more people in the highest vulnerability groups who are likely to get very severely ill or to die getting infected. So the idea then is to make sure that we cover as many of those people to the most optimal level with a second dose. I hope very much that we will soon get out of this situation with some of the developments, which I'm sure Ms. Nguyen will tell us in more detail about as we acquire more vaccines later on in the year.
Thank you, Dr. Moeti. Our second question is to you, Professor Tullio. WHO has repeatedly warned that leaving large parts of the world unvaccinated creates scope for emergence of new variants of concern. To what extent do you think the same is true for countries like South Africa? Is there a risk that slow vaccination in pockets of the country could lead to emergence of new variants? Prof?
Yeah, thank you for this question. Yeah, I think that the answer is quite simple. Yeah, we have seen that around the world that these variants, they have emerged in Africa, they have emerged in South America, in Europe, and Southeast Asia. So the main important answer is that if we left countries behind on the vaccination and the public health response, we just give more chance to the virus to evolve and new variants to emerge. Yeah. In the last few weeks, we found a case of a HIV immune-compromised individual that could not clear SARS-CoV-2 for over 200 days. He only cleared when the antiretroviral therapy became very effective. And during that process, most of the mutations of variants have been developed on the virus infected that individual. Yeah. So it's very important, more than ever, that we treat that as a global pandemic. And if we leave countries behind, such as Africa or other limiting countries, we just give chance for new variants to emerge.
Thank you, Prof. Kelly Jane, are you there? Do you want to go with your question?
Yes, hi, good afternoon. My name is Kelly and I work for IOL News in South Africa. My question is to Dr. Moeti. A very big topic right now is the Lambda variant. And I just want to know how many cases have been detected in how many African countries? Has it been shown to be more transmissible? And it's currently a variant of interest, but it could soon be a variant of concern. And what would be the situation to drag it over the line to being a variant of concern? Thank you very much.
Okay, thank you for that question. Actually, I'll pass that question over to Professor Tullio as well, because he's kind of at the coal face of both the tracking and the surveillance for a new variant. So yes. Tullio, if you don't mind.
Yeah, thank you. To be honest, our Minister of Health and President asked that same question to us a few days ago. So at the moment, no country in Africa has detected a Lambda variant. Yeah. What it means that in all the recent genomic surveillance that have been done, we haven't had a case of Lambda yet. Yeah. However, we are doing increasing genomic surveillance both in South Africa, but with the WHO Afro and the Africa CDC in most of other African countries. Yeah. I am part of the WHO Evolution Working Group that define variants. Yeah. And as you are aware, the Lambda, it is the new variant of interest. It has been defined as a variant of interest on the 14th of June. And it seems to be increasing prevalence in the Spanish-speaking part of South America. At the moment, both the WHO Evolution Working Group and other agencies are looking very careful at that variant. And if it starts increasing prevalence in other places that have other variants of concern dominating, it's very quick, we'll move for a variant of concern. At the moment in Africa, we are alerted about that variant. We increase genomic surveillance, but at the moment, not a big concern. The real concern one at the moment is the Delta variant that is much more transmissible and is causing a large number of infections and a very big third wave.
Thank you very much, Prof. Alex, are you there? Alex? Okay. So, Ms. Aurelia, okay,
So,
are you
sorry.
yes?
Sorry, Dr. Mary, I'm here now. Can you hear me?
Yes, please go ahead with your question.
Thank you very much. I have a few questions, but they're quite factual, so hopefully I can move quickly. For Ms. Nguyen from COVAX, your forecast for 520 million doses for Africa by the end of the year, when does that forecast assume that the Serum Institute will restart exports? What's the latest that they've told you? And as part of that 520 million dose forecast, how many of those doses are coming from, donations from countries like the US and France, and how many are directly from manufacturers that COVAX has signed contracts with? And if I could ask Dr. Moeti, how many African countries have run out of vaccines completely? And if I can also slip in one final one to Prof. Tullio, is there any sign, I know that the spread of Delta is driving up infections, but is there a sign that the spread of Delta is significantly driving up deaths in Africa in this third wave? Thank you.
Thank you, Alex. Let's start with you, Ms. Aurelia.
Thank you very much for the question. And indeed, we've been putting a lot of effort into looking at the supply forecast and the elements of variability that drive it. So the delays that we're seeing indeed right now are caused by the fact that due to the very dire situation in India, the supply from the Serum Institute of India has been used domestically, contrary to the plans originally put in place, which were for use for COVAX globally. We've been in close discussions with the government of India and with the Serum Institute in terms of resuming of supply. I think it's still a fluid situation given the situation in India, and we've been factoring in resumption of supplies towards the later part of the year. What's important to note is that we've built a diversification strategy to be able to help mitigate these shocks that we've encountered. And by diversifying our portfolio, we now have 9 vaccines or vaccine candidates in the portfolio. If one manufacturer is not able to deliver, we will be able to compensate with new manufacturers coming online. So that really gives us confidence that we will be able to hold to the forecast of delivering 520 million doses to Africa towards the end of the year. And to your question on donations, so we've had a lot of discussions with countries who have excess doses who are planning to donate them through COVAX. At the moment, we have commitments for over 500 million doses to be donated through COVAX as a whole. We do think that there is room for more donations to come through. It's particularly important during the third quarter. At the moment, as you've heard very much, the need for vaccination in terms of addressing variants is very pressing. And so donations have an important role to play now. Thank you.
Thank you, Ms. Aurelia. Benjamin, can you ask your question?
Oh, I thought
Benjamin,
other questions unanswered.
Okay, if you're not there, I'll ask Dr. Richard Mihigo and Nixie.
I'm there, please, I'm there. Can you hear me?
Okay, go ahead with your question, please.
Now, Mary Stevens, thank you so much. Thank you so much. Can you hear me?
Yes, we can hear you. Go ahead.
Okay, my name is Benjamin Ahenda. I work for Science Dev in Kenya. Right now, I'm in Nairobi. Now, I have 2 questions which I wanted to ask. Number 1, the African countries, particularly the East African countries, Kenya, Uganda, and Tanzania. In Kenya, we have had the Delta variant, which is now actually taking toll on the western part of Kenya, that is Kisumu and the other part of Kenya. What is WHO doing to curtail the spread of this variant just before it goes beyond the borders? And number 2, as WHO African regional representation here in Africa, what are you doing to ensure, the African countries get enough vaccines to vaccinate its population, so that by the end of the year, we get the 60% vaccinated population to contain the situation? Thank you.
Thank you, Benjamin. Nixie, please answer the question on variant, and Dr. Richard, please, the question on vaccine. Let's start with Dr. Nixie.
Thank you so much, Mary, and a very good question from the journalist. For the Delta variant that has been spotted to be showing such an increase in the African region, WHO has put so much effort to support these countries. As you know, that we've got a team of experts that has been dispersed or deployed to these countries, especially those that are facing a serious resurgence that are associated with the Delta variant. So the experts from all different areas as far as WHO is concerned. So to make sure that also we cover as much as possible in each and every country in terms of the prevalence or the spread of the Delta variant, we have scaled up the sequencing capacity in these countries. And as WHO, we supported these countries in terms of financial resources. We supported them in terms of technical expertise that are working very closely with the countries. So as much as that is concerned, WHO has moved all out to support these countries and also to give the expertise to go and support the spread of this variant in these particular countries. Over.
Thank you. Dr. Richard?
Yeah, thank you very much, Mary. I think there was a question by the previous journalist where he was asking whether the number of countries have run completely out of the vaccines. So I think as we have heard in the introductory remarks by Dr. Moeti, there have been a lot of effort, and particularly after the June month, where vaccine delivery has completely stopped. The different donation that came from a few countries have at least provided a few relief for those countries, where we had 11 countries that had almost used up their doses completely. And these countries were prioritized to receive some of these donations to try to make sure that there is no much big gap between the different doses. So a lot of efforts are currently being done in conjunction indeed with our partners working through the COVAX initiative to make sure that the country are receiving the doses as much as they can. Now, on the second question on how do we ensure that Africa gets, again, it is the same thing. WHO, and we have been, I hope, following since the beginning this press conference. Dr. Moeti has been a great advocate for equal distribution of vaccine on the African continent. We have worked quite hard through our colleague in the COVAX facility to make sure that Africa is prioritized. A lot of advocacy also to make sure that the various donations that are currently being pledged are transformed into concrete vaccine delivery on the ground. So there is a lot of background work that is being done and a lot of work in the background to make sure that Africa is prioritized, Africa, the voice in Africa is heard, and really WHO, and we have great opportunity to have a leader that is really for the moment fighting on that front. So we do hope that all of these advocacy are going to pay off, and we heard from Mrs. Aurelia that starting in September, we are going to see a dramatic increase in the number of doses coming to Africa. Over.
But can you, hello? Hello?
Yes.
Yes, go ahead. Okay, Dr. Moeti, do you want to weigh in on these questions?
Yes. Yes, thank you, Mary. I don't know if Benjamin is still there with us, because I wanted to add something to what Nixie said. about what WHO is doing in order to help stop the spread of these variants in African countries. We know that the Delta variant is predominant as well in Uganda. We heard this from the Minister of Health of Uganda a couple of weeks ago when she joined us on the press conference. I just want to emphasize that in addition to supporting the countries to know what variants are circulating where in their territories, of course, one of the things we continue to do is to support their work in preventing transmission, in reinforcing the public health measures, in making sure that they are using data to know where the variants and when the virus is continuing to spread, where their hotspots are, where the most intense transmission is happening, where the most illness is happening, and really to reinforce what they're doing in the basics of stopping the transmission of this virus, meaning testing to know who is infected, tracing contacts, isolating people, and helping the population to understand the need to practice the prevention measures like wearing masks and distancing, and sometimes, as has happened in South Africa, applying even more severe social measures to stop people moving around and gathering in groups. So this continues to be the core of what WHO continues to support countries to do. And I'm just saying this because the core message is that people, the population, also need to understand our best tool against the variants, of course, is a vaccine. And we know that the Delta is highly transmissible. Apparently, if you walk past somebody who is infected with the Delta in a shopping mall without being totally closed, you both have to be wearing masks if you're going to reduce the risk. So those public health measures, supporting the countries to practice them, helping the population understand, that is what we continue to do and what we continue to emphasize. Thank you.
Thank you, Dr. Moeti. Very insightful addition. The next question, I'm going to throw it back to you. And then the second part of the question will be to Professor Tullio. So in countries like the Democratic Republic of Congo, where vaccine hesitancy is increasing, what does WHO plan to do to work with authorities to change this situation? This is for you, Dr. Moeti. And to Professor Tullio, can preventive measures such as wearing of masks, hand washing, change the situation in South Africa? So we start with Dr. Moeti first.
Yes, that's a good question. I mean, first of all, I'd like to say about the DRC that we were very excited and happy to see the Minister of Health and several other leaders in that country publicly get themselves vaccinated. We hope this will encourage people to believe in the vaccines and to come forward and create a demand. We have recognized that there is a lot of work to do to address vaccine hesitancy, vaccine refusal in the DRC. And this work needs to be done very much with local people, local groups, helping to, first of all, understand what it is that people think, feel, fear, don't like, don't agree with about the vaccine. And then secondly, really getting across the information to the people about the benefit of being vaccinated. I believe as the situation is getting worse and worse, this is starting to take some shape. We've advised as well that those who have been vaccinated themselves can be part of the communication, and then we need to get into the different networks, the religious groups in the DRC who are very active, the civil society groups, the social media, and with our team working on the Infodemic initiative and our partners, we really need to, and we are working to help the government, civil society groups, other groups to help people understand the benefit of being vaccinated and to persuade them to be vaccinated, because the DRC is about to be a beneficiary of one of the donations of vaccines.
Thank you, Dr. Moeti. Professor Tullio?
Yeah, thank you. Yeah, just before was a question that asked if the increase of the Delta variant in Africa is translating into not only infections, but death. And the answer is yes, and very fast. And I would suggest people to check the data, for example, of number of deaths per 100,000 individuals, not only in South Africa, but also in other countries that do not have high vaccination, such as Russia, Indonesia, and Bangladesh. The increase of the Delta is translating very quick in a very fast increase on mortality. In relationship to to South Africa, and the question was if the non-pharmaceutical interventions of mask, washing hands, and social distance would be effective. Yeah, at the moment, with the level of the third wave, we needed more than that. Yeah, we know that the non-pharmaceutical interventions work. We have no doubt about that. But the government had to increase some of the restrictions, yeah, which to protect our healthcare system, which is very, very overwhelmed. And that together with the increase of oxygen, healthcare workers, or opening satellite hospitals for isolation, and of course, increased vaccination. Some very early data was presented last night by the CEO of the Discovery Health, that's the biggest medical aid in South Africa, that already show that vaccination, it is starting to have an effect on hospitalization, especially even only with one dose. So I think that's crucial that South Africa continue some of the restriction, but increase the vaccination because some of the healthcare systems are already completely overwhelmed. Thank you.
Thank you, Professor Tulio. The next question is to you, Ms. Aurelia. Please feel free to answer in French. The question is coming from RFI. The problem isn't just the lack of doses, but also vaccine hesitancy in some countries. And some countries are throwing away vaccine. Can the diversification of the vaccines help address this problem? Ms. Aurelia, please.
Merci, Madame Jeanne Richard, pour votre question. En effet, la question sur la défiance envers la vaccination est une réelle préoccupation. Avec les partenaires à l'intérieur de COVAX, nous avons vraiment travaillé pour adresser les barrières et encourager les populations et les communautés à se faire vacciner. C'est une priorité. Nous avons eu le conseil d'administration de Gavi qui a approuvé 775 millions de dollars très récemment pour financer le soutien au pays pour l'acceptation des vaccins, pour la mise en place de l'assistance technique. Et cela s'ajoute à 150 millions de dollars qui avaient été déjà approuvés auparavant. Donc, avec ce financement, ce que nous voulons faire donc, avec les pays, c'est vraiment de travailler en partenariat pour s'assurer que les systèmes de santé vont être capables à faire la communication qui a besoin d'être faite et aussi pour avoir l'infrastructure en place car il va y avoir des grands mouvements à faire en termes de vaccination une fois que la fourniture des vaccins va pouvoir se débloquer.
Thank you, Ms. Aurelia. There is still a second part of the question that you need to answer. Was the COVAX overtly reliant on Serum Institute of India as a supplier? And in light of a reduction of supply from the Serum Institute, can you share which other institutions you have partnership with? And what is the contingency plan for supplies outside the Serum Institute of India?
So thank you very much for the question. I'll switch to English. The relationship with the Serum Institute with Gavi has been a long-standing one. Serum Institute provides 9 vaccines to Gavi in developing countries, including the meningitis A vaccine, which essentially means that thanks to this vaccine, there's very little meningitis A left in the meningitis belt. So this informed the choice, also the fact that they had early supply of a very affordable vaccine. But indeed, we saw with the situation in India that the restrictions on availability to volumes means that we cannot count on a single supplier, and hence why we diversified very strongly. So we currently have supply coming from AstraZeneca, Pfizer, and the Serum Institute of India. We have deals with Johnson & Johnson, Moderna, Novavax, Clover, and Sanofi GSK candidates, which will help really bring the diversity of supply so that we can have access to a large number of vaccines and also a large volume. We will be announcing very shortly more vaccines that will be available in the very near term to help increase the immediate term supply. So that's very much the strategy that we've taken so that we can have a resilient portfolio and we can have the diversity and the volume that we need to be able to meet our target to get to 30% vaccination coverage in early 2022.
Thank you very much, Ms. Aurelia. Ashwin from Observer Times in India. Are you there? You wanted to go live with your question.
Yeah, thank you for giving me opportunity to ask the question. My question is, when shall we expect ideal characteristics in COVID-19 vaccines, which can be administered with routine vaccine programs of each country, and it doesn't require frequent booster doses? As of Observer Times demands and campaign for ideal characteristics in COVID-19 vaccine and published an article on this. Thank you.
Thank you, Ashwin. Dr. Richard, you can go first and Dr. Moeti can complement.
Yeah, no, thank you very much. I think this is a very interesting question. I think the objective of the current response to this pandemic is really to make sure that we can stop transmission and we avoid to have this virus becoming endemic. It's clear that at the pace by which we are seeing boost variants that are starting to emerge, there is definitely a possibility that in the future we may be needing some booster doses to make sure that people with the current level of protection, we can sustain the immunity level for a long period of time. So for the moment, there is no particular discussion to have this vaccine introduced into routine, because that will mean that we have now a very established transmission in an endemic mode, which definitely we want to avoid as soon as we can. So I think that's what I will respond to this question.
Thank you, Dr. Richard. Dr. Moeti, let me add a question to you and then you can answer it together. This question is from Paul from The Lancet. What is the update on the EU countries with regards to the approval of the Covishield vaccine?
Okay, thank you. Well, I don't have much to add on the previous question, really. I think that there are discussions going on that we might have to eventually accept a situation where this virus is endemic and we keep giving boosters, as has happened somewhat with the influenza vaccine. But I think at the moment we're working really to hit the virus as hard as possible in as many countries as possible and very much minimize its continuing circulation. And then as far as the emergency use licensing by the European Union, I'm aware that our colleagues who are in charge of this dossier in WHO in our headquarters are in continuous discussion with the European Medicines Agency and also with the European Union in advocating for this to be advised to their member states. I think the reality is that there is a regional regulatory body, which is the European Medicines Agency, which makes its own determinations, and then it is left to individual member states, their regulatory bodies, to finally agree which are the vaccines that they will recognize or approve for emergency use listing. So what I would say is that this is an ongoing conversation. I've seen some media reports, but not yet had confirmation that some of the European Union member states are agreeing to, in a sense, use the WHO emergency use licensing to themselves, accept to have people travel into their countries and to license it. But I've not seen any official confirmation of this. I've also understood that the United Kingdom, which is of course no longer an EU member state, but is receiving its vaccines from the Serum Institute of India, the same AstraZeneca vaccine that is also being produced in Europe, has also made an appeal, reached out to the EU to have this vaccine, if you like, recognized as the basis for people to state they're vaccinated and be able to travel to some of the EU countries that have put in place the so-called green passport. So this, I would say, is our conversations that are ongoing at the moment.
Thank you, Dr. Moeti. And Ms. Aurelia, this question is coming to you. Which companies are expected to supply the 500 million doses to Africa by the end of the year? And what would you say are the main bottlenecks for achieving this volume?
Thank you very much. So at the moment, it's the whole portfolio of COVAX that will be made available to countries in Africa. So current suppliers, AstraZeneca, Pfizer, and Serum Institute of India, suppliers to come, Johnson & Johnson, Moderna, Novavax, Clover, and Sanofi GSK, depending on how those developments go, and we have more suppliers that we will be announcing shortly. So it is this combination of suppliers. The second part of your question, sorry, if you could restate it, please.
Okay, the second part of question is asking about the bottlenecks in achieving the supply.
So indeed, there are a number of steps that need to take place in terms of the work for getting the countries prepared, which are around regulatory approvals, signature of indemnification and liability. But I think very, very important is around the preparation for delivery. And I think this is where we need to have a very, very strong push to ensure that countries are supported as best as possible and are putting in place plans to be able to have successful implementation campaigns. And I think on this note, particularly, very much, I think from a COVAX perspective, for us to call on the donors, on the multilateral development banks, on the manufacturers, and on the partners to really pull together to make sure that when the doses arrive, we are able to put them in place. It's going to take a very strong partnership for that to happen. So some upfront preparations that need to be done, but also a lot of work on the ground in terms of preparing the health systems and having the infrastructure and training in place.
Thank you, Ms. Aurelia. That was a question from Development Today. And then we are going to the next question from NHK. This question is coming to you, Prof. And then Dr. Nixie could complement. Please elaborate on how much the Delta variant is serious, not only in South Africa, but also across the continent. Prof, you start and Dr. Nixie could complement.
Yeah. Thank you for the question. Yeah. At the moment, what we know, and we are working together with the WHO and the Africa CDC to analyze genomic data across the continent. So what we know is that the Delta variant is starting to dominate the whole infections in South Africa, but also have been detected in most of the neighboring countries, and all the way to Malawi. So it seemed to be entering in a similar way as the Beta variant did, come from the south and going north. So it's not surprising if in the next few days confirm that's dominating most of the third wave that's growing in Southern Africa. We also know from some very good work from colleagues of Kenya, Uganda, and Rwanda that the Delta variant has displaced the previous variant that was there, was called the A23.1. So it's again similar what's happened with South Africa, displace another variant and causing the majority of infections. We know from colleagues working in West Africa, from Senegal and Ghana, that they also have been detecting that at a high prevalence. And we also know from colleagues in North Africa that it is the most prevalent variant at the moment in North Africa. So at the moment, what it means, we know that has been present in Southeast, also Central in the DRC, West and North. And in the next couple of weeks, what we are doing as a collective of African scientists with the Africa CDC is to increase genomic surveillance to all the countries. So just to confirm that. But unfortunately, as we have done in South Africa, that we have confirmed in many, many different provinces, we unfortunately expect to be quite similar, that as the case increase very fast, that the domination of the Delta variant will increase in Africa. Thank you.
Thank you, Dr. Nixie.
Thank you, Mary. Yes, I'm just going to add to what Prof. Thule has just mentioned here. What we are seeing is that almost the entire continent, in each and every sub-region of the continent, we are having 1 or 2 or 3 countries that have reported the Delta variant. And this Delta variant seems now to outnumber some of the variants that were reported previously. So to add to the 10 countries that of resurgence that Dr. Moeti mentioned earlier on, in total in the continent, we've got close to 17 or 16 African countries that have reported the Delta variant. And then what we have seen is becoming, even in numbers, more reported in the southern part of Africa, as well as in the east, where we are talking about more numbers of the Delta variant being reported in Uganda, as well as Kenya. In the central, as well as in the west, the numbers are coming, but not as much as in the southern part of the continent, as well as in the east part of Africa. That's it from my side, Mary. Thank you so much.
Thank you, Dr. Nixie. This question is coming to you from Shunwa, Dr. Moeti. How severe is the third wave in Africa? And should we expect some light at the end of the dark tunnel?
I'm sorry. Yes, as I said in my introductory remarks, this peak is severe, and it's attributable to this highly transmissible variant of the virus partially. So it has overtaken the second peak that we had in the early part of the year, certainly, and we still see the numbers per week of new cases growing compared to the week before. We've got now about 16 countries or so that are in resurgence, meaning every following week there are more and more cases than had happened the previous week. So we're going in for a quite difficult time as we see this variant spreading geographically to more and more countries. As it starts to peak in some places, we hope there will soon be a peak in South Africa, which for the moment accounts for 53% of new cases in the region. So it's really driving the third wave. But the challenge is that as this variant spreads to more and more countries geographically, they will also take off in terms of the speed of the increase in number of cases. So I think we're in for some weeks of a very difficult situation of an increase in the number of cases, a third wave, which by now has already overtaken what we saw previously in the region. We'll certainly see light at the end of the tunnel. Countries will perhaps inevitably have to reinstitute some of the measures that go beyond public health barriers at an individual and personal level. And of course, we hope that soon the vaccine restart of the vaccination campaigns will start to have an impact. But I'm afraid the next couple of months are going to be very difficult on the continent as we see the spread of the variant.
Thank you, Dr. Moeti. We are now coming to the end of the press briefing for today. So we will turn back to our panelists. I will give you 1 minute each to wrap up. So I will start with Professor Tulio, then Ms. Aurelia, and then Dr. Moeti.
Okay, just to wrap up, our work here in the institute that I run is not just to produce and analyze data, but it's also to train Africa scientists. So at this week, we also have two researchers from the Ministry of Health of Malawi. We have host Mozambique and Angola, and we have produced close to 50% of the genomic data in the continent. And we're gonna continue doing that, to really support a lot of the data generation and analysis to be done in the continent, to be done locally. Thank you.
Thank you, Professor Tullio. Ms. Aurelia?
Thank you very much for the opportunity to be with you today. And I think to share that, from the COVAX perspective, we are working very hard to address the situation where Africa has not received enough doses yet, so 25 million to date. But I think with the global supply constraints that we've seen, not just affecting COVAX, but affecting all, I think we are working really hard. We're on target to our initial view of 1.9 billion doses at the end of the year. So 2 billion was our initial view early next year. And that will be 520 million for the Afro region. And we're going to be on track to get to this by early 2022. But I think really a strong call on our side for all of the partners, the multilateral development banks, manufacturers, donors, and others to really work together to make sure that we redress this situation and make the best use of the dose donations coming through now. Thank you.
Thank you, Ms. Aurelia. Dr. Moeti, in your last remarks, I want to give you one question to address from business news in Ghana. With the shortages of vaccine and procurement challenges in Africa, should we not be looking at placing emphasis on supporting local production of vaccines in Africa, especially in countries like Ghana?
Oh, yes, indeed. I think if there's one positive result of this very difficult situation, it is the focus now on diversifying places where vaccine production gets done, and a rather rapidly evolving process of initiating this in African countries. You may be aware that a couple of weeks ago, the South African president with the French president have made announcements of, with support from the European Union, of the establishment of a hub in South Africa to start the process of local production of these vaccines. And this hub will serve not only for production with some pharmaceutical firms in South Africa, but also for training, building capacity to expand this to other countries. There are discussions ongoing with Rwanda as well. And we know that in Ghana, there is some capacity. So there is a strong push for establishing production locally on the continent, which is an excellent thing, not only for this pandemic, but going into the future for vaccines and other pharmaceuticals. I believe this is a very good development. So I'd like to just end by saying that it has been a very challenging situation for the African continent and for African people. It's going to continue to be with the emergence of variants and the surge that's currently happening. But I'd like to add my own voice to the fact that we are starting to see the situation turn around and vaccine supplies become available. As WHO, we are determinedly analyzing the experience of the previous campaigns and looking in detail with our partners at what could be some of the obstacles and challenges that confront countries as they try to roll out the vaccines that they are going to be receiving. And we've learned that partly it's to do with financing. So it's a very good thing that resources are going to be made available through COVAX and other partners. We know that the Afreximbank, the World Bank, and the African Development Bank were in a discussion about this. They're starting to take an interest. Financing should become available. The human resources, the sites where vaccines need to be delivered, the cold chain. So we are on the ground with our teams in WHO, really helping the governments analyze what could have gone better last time, what needs to be done in addition, so that we don't waste the opportunity represented by these vaccines that are going to become available. This is what's going to enable Africans to go to a football match, as shown by Tullio in his slide. And I'd like to end very much by thanking our two guests. Thank you for everything that you are doing. And thank you for having joined us to, through the journalists who joined us, inform the African public and the world at large what is happening in Africa as regards access to vaccines and the emergence of variants. Thank you.
Thank you very much, Dr. Moeti. We have now come to the end of the press briefing for today. A very big thanks to all our panelists for the interesting discussions, and thanks to the journalists for the work you're doing in making sure that the messages get out there. Thank you and have a nice day. See you next week.
Thank you. Bye.